Today I'm here to answer two questions. Who owns your health data? And what is it worth? When we think about our health and wellness, typically we think about eating right, exercising, having a bit of ice cream on Fridays only if we earned it, right? We're usually not thinking about the collection of our data at a large scale, or that we are willing participants to adding to that data pool. So how does this happen? Well, it all starts with an experience that we have in common, known as birth. Birth triggers the collection of our data, health data collection process. That is the start, and it is entered into something called an electronic medical record or an electronic health record, typically done by your nurse, primary care physician. And through this, over the years, if you are good and you go to the doctor, first of all, congratulations for adulting properly if you have your annual checkups going on. They add to it, and it adds your allergies, intolerances, conditions, lab reports, anything that you would discuss with your primary care physician. And over time, that information continues to grow. But not all of us have the time to go to the doctor because we're all so busy. So cue the health tech market. Wearables like my Fitbit here can track every pulse, every step, every breath, all of our vitals on the go in a convenient app on our phone and in our watch. And if we want to get more granular with the data that is being collected, well, we can order a DNA kit from 23andMe and Ancestry.com. Tell us about what we're genetically predisposed to. Or there are other devices like smart scales, watches, blood pressure cuffs, and all of these things that contribute to adding to our digital health footprint. But it doesn't stop there. So in order for us to use these amazing devices, products and services, requires our consent. You know, the terms and conditions that we all hastily scroll through so we can get back to our lives, we check that box. And that's where the consent happens. That's where this gets interesting and where I answer my first question. Who owns your health data? The data owner is you. You just consent to organizations to be able to use it. Companies like Epic, Cerner, Fitbit are all allowed to profit from your personal health data by sharing it with research institutions so they can solve more problems, create more discoveries to enhance and lengthen life, all because you consented to it. GlaxoSmithKline and 23andMe have signed and extended their agreement to leverage consumer genetic data for more discoveries, starting with a royalty payment of $50 million, and then an additional equity investment from GlaxoSmithKline into 23andMe for $300 million. And that is just for access to that data. Nothing about the discoveries or the commoditization or manufacturing of what comes from what they discover with that data. Epic and Anthem entered into a data sharing partnership in 2021 with the goal of sharing health data with insurance companies. The intent was to improve interoperability. And with that, they are taking into consideration the cost of your premiums and your prescriptions because of access to that data. And these are just a few examples, but don't worry. This isn't intended to be a horror story. There is hope, and you do have a choice, even though right now I'm making it seem like you don't. But those companies, they are banking on it. It's no secret to how profitable data sharing has been, and how comprehensive EMRs tend to be, especially when that is the primary source of patient health data that is collected by providers. In turn, a few crucial pieces of legislation have been enacted to give people power back over their data. The first was the 21st Century Cures Act of 2016. This was intended to advance interoperability between health systems and to prevent software developers and their companies from engaging in information blocking, which I'll talk a little bit about more later. So this increases the public's access to personal health info and where you are able to share it. This means that any health system has to be able to integrate directly with a third-party application. So, for example, if you go into your Apple Health app or your GenomeMe application, you're able to log into your Epic MyChart or Cerner, Sorian, or Millennium account, and bam, all that information can get synced. Yeah, at the touch of a button. A more common method that we use is probably ordering pizza, right, through DoorDash. So when you go on DoorDash, you're able to either enter everything manually from your email and all of that, and it takes a little bit, or you can just select continue with my Google, Facebook, or Apple account, and it'll sync everything from your name, payment info, to your address, and you save a ton of time. Interoperability is not necessarily a bad thing. It allows us to combine our health data all in one place so we can have greater control and access to it, and who we're able to share it with. I think this is key to creating a more patient-centric world, and if we want to be patient-centric, patient ownership of that data is essential. But the sharing of health data only matters if you know your rights around it. As a patient, yes, but more meaningfully as data owners. The second piece of legislation was after the review was conducted by the Office of the National Committee and the Centers for Medicare and Medicaid Services. This was to intend to make that health data more transferable. So it has to be in certain standards required by the US CDI or the US Core Center for Data Interoperability, so that when data is transferred between different systems, it's easily readable. That's one piece of it. The other piece of it is to make sure that people like you and I are not prevented from accessing that information through information blocking. Traditionally, organizations would do this by charging a fee for people to access their health records. Now it's illegal. So thanks to this, your data, with your permission, can be shared with nearly any platform with relative ease. Okay, so you're wondering why I'm telling you this, right? It's because the rules and rights around data sharing have changed. But a lot of people don't know that. A lot of providers don't know that. Matter of fact, a 2021 study conducted by Life Image showed that 47% of healthcare leaders still don't know what information blocking is or what removing those blocks means for their patient populations. Another 30% said that they were aware of the rules around information blocking, but that their organization still engaged in it anyway. So how can we expect patients to be informed of their own rights if their healthcare providers do not know them, or worse, those providers aren't willingly sharing that information with their patients because they're not required to? There are fines associated with engaging in information blocking, but there's nothing requiring those institutions to educate their patient populations. So, to summarize my answer to your first question, who owns your health data? Well, you do, but it's complicated. My second question, and the answer to that, what is this health data worth? You ready? That answer is also complicated. At one level, it's priceless, but priceless isn't the same as free. The healthcare industry in the US is a $1 trillion industry, and that's for the collective use of that data, from pharmaceutical companies conducting clinical trials, to primary care physicians and access to different health systems and sharing that information, to training AI tools on large amounts of data. What it's worth at the individual level, we don't really know yet, but we know it shouldn't be free. And this is where the value of responsibility and opportunity intersect. Responsibility for us to be able to do something good with our data, to be able to share it with the populations that can do the most with it, and opportunity, because researchers need to better understand us to diagnose, treat, and cure people like us. And the benefits here are numerous. The most obvious one is for us to be able to charge institutions a fee. It's personalized to each individual's health data record, whether that's through the robustness of the data, participation in clinical trials, or anything in between. And commodifying and selling that health data traditionally has been a taboo subject, has negative connotations, but that's because it's been happening without people's knowledge, without their consent. Through our ability to better obtain, regulate, and be transparent about where we share our data, and we can control it, that's not an issue. Another benefit, and arguably a greater one, is our ability to improve our quality of life. And that's not just for ourselves, but for the human race. Humans are not homogeneous, but the data pools that we typically develop our drugs and treatment plans from typically consists of middle-aged Caucasian male data, because that's the demographic that can afford to go to the hospital. The ones that are insured, the ones that have easy access to clinics. Our collective contribution can allow for people from all walks of life, not just those that can afford it, the ability to receive better tailored, more personalized standards of quality care, and directly from our participation in clinical trials. Having a significant pool of data on diverse populations is tricky for many reasons, but mainly culturally and economic. From a lack of nearby clinics in certain neighborhoods to a lack of trust for healthcare professionals. These populations may be reluctant to see a doctor, so the information in their EMR is limited, but many have access to a smart device. They can download health-friendly applications where they can track different types of health data that they can input themselves. And they'd be able to receive passive income from this. This could be the start to building a foundation of trust when diverse populations are being paid fairly for their health data. In this way, healthcare institutions can begin to make up for the historical wrongs that have been inflicted upon the BIPOC community. And I'm not saying that this is going to solve everything, but it's a start. And I care about it because I'm part of the population that is underrepresented when it comes to receiving a standard of care. I care about this because I have had to make the choice between going to a doctor and remaining employed so that I could keep my lights and my heat on. Now, if the Cures Act and the final rules were in place sooner, I wouldn't have had to make that choice, like millions of people have to do today. The concept around monetizing data is not a new one, but with more people becoming educated on how to access and share their data, we have the ability to change the way data sharing is conducted, making it a more regulated, inclusive, and equitable practice. And right now, I'm talking to you, my fellow human beings, because I'm also a human being. Not as executives, not as clinical site study managers, not as investors, but you. We have the right to be responsible data owners. And there's a few principles to adhere by. The first, participation through fair compensation. We organizations, us business owners, us founders, we need your consent, not the other way around. So give your data value. Monetizing your data is good, and more people need to be willing to do this. It starts with understanding your rights around sharing your data. This can increase the quality of how data is shared from a regulatory standpoint and increase the value for interoperability amongst clinical study sites, research institutions, and more. So by giving it worth, good things will happen. And finally, take back where you manage your data and who you share it with. A key part of being a responsible data owner is practicing data transparency. It's not taboo anymore if you've consented to sharing your data and those you share it with inform you of where your data is going and the good that it's doing. Although it may be a pain to read through those terms of service, terms and conditions, we have tools now like ChatGPT that can help you quickly scan those documents for any type of ambiguous or questionable phrases about what is really happening with your data. If you don't feel comfortable with signing off on using a product or a service, then don't. You have more power than you think. And the person that knows what's best for you is you. So now that you know your rights around data sharing, we need to work together to engage in responsible data sharing practices that can add value to humanity in a major way. It's been an honor and a privilege to be on this stage, and I thank you so much for listening.